As the world struggles to find a vaccine for the novel coronavirus, so many people have come forward with claims of having a cure for the virus. An underworld of quack doctors and con men have been exploiting the COVID-19 pandemic and making money selling fake coronavirus cures. Investigative reporter Anas went undercover in Ghana, exposing a COVID-19 scam said to be worth thousands of dollars. He joins me now via Skype from Accra in Ghana. Anas, good morning. It's good to have you join me this morning. And let me say that we really appreciate what you're doing and we commend your effort in investigative journalism. In your documentary, your expose documentary, Corona Quacks, COVID Quacks as the case may be, talk to us basically, what was the greatest surprise that you found at the course of doing this investigation?
Well, the story happened both in Ghana and Nigeria, as you already know. And the motivation for the story was simply the fact that during the lockdown, all of us had to deal with
all right. Now, after this, it seems the line has gone off. Okay. Now, there is a documentary by Anas Corona Quacks, and that has exposed a lot of scams during this pandemic, where a lot of people came up with claims of breakthroughs, claims of vaccines, claims of cures in parts, not just in Ghana, but across so many countries of the world and even in Africa. Now, okay, Anas, I understand Anas is back on now, yeah? The line went off briefly. It's nice to have you back. You were saying something earlier.
Yes, I was saying that under this lockdown, all of us felt that heavy burden of thinking of cures and others, which sometimes makes the journalists forget that we are living in a special time and that we have to apply our tools. Having done this job for a while, I know that when things like this happen, there are certain people whose mindset will be to exploit the situation and make a lot of money out of it. So my aim in this investigation was to go deep down there to see those who are taking advantage of the panic situation, those who are taking advantage of the gullible people to make a lot of money. The investigation, like I said, started in Nigeria, where we met a pharmacist, Dr. Abdul, who claimed to have a cure for COVID-19 and who claimed he could cure cancer. And we saw a pastor too in the film. You see a pastor who claims he has a cure. You see another herbalist who says he has a cure and all that. Now, all this is fine. I'm a very strong believer in traditional medicine. But all this ought to be measured against science, especially when we all know that there is no cure for AIDS. There is no cure for COVID-19. If somebody begins to bring this, it's worthwhile looking at it. Now, back to Ghana. So in Ghana, the undercover featured two main organizations. One is called FX and the other is the Abdallah Brothers. Now, the other Abdallah Brothers were part of Ghana and took advantage of the region, which I can say is not very, very developed like Accra. So went on radio, announced that they've gotten cure for COVID-19, went on TV, made similar announcements and urged people to come and buy. Now, whilst saying this, they urged people that though they were putting out these adverts, they were going through the regulatory agency to ensure that this drug was finally approved. We went behind the scenes undercover, spoke to them, and they were busily selling. They had, according to their own words, they had sent some to Italy. They were treating some ministers of state, and they had given lots of it out to people. Now, the big question was, had this been tested? Now, in fact, in one of our meetings, they told us the vice president of Senegal had been had requested for some of the medication. So they whipped up quite a lot of sentiment around it, urging people.
The vice president of Senegal, do they have the office of the vice president?
That they have no office of the vice. That's what I'm saying.
Okay.
When these quack people take advantage, they will say anything to convince you. You understand? They even mentioned our king, the big king here, the Asante Hene, that he was also someone who had endorsed this particular thing and was doing business.
Okay. And as certainly one would see all of those as really deceitful on their own part, trying to, say what is actually not founded and what is practically not on ground or factually on ground. Now, talk to us basically, because you mentioned earlier that they went on radio and went on TV to make these claims. And it is of great concern that anyone will come up on TV where there are regulations, where there are supposed to be regulations. Talk to us about that. How is the media regulatory authorities handling when people come to make false claims on air?
Well, the false claims, first of all, ought to be investigated. And that's exactly what we did in this particular film, trying to measure what we've heard with scientific evidence. So you see us going to the lab, the Ghana Standard Authority, which is ISO certified, one of the best in the world, and putting this drug to test and looking at the ingredients. For example, in the Abdallah brothers, you would find that they had a lot of infestation of yeast and mold, uncountable numbers, and had even something we call phosphate, which could all be detrimental to human health. And, when I was negotiating with them, one of them warned me that if you take one of the medicine, you could get diarrhea. And that if you get diarrhea, it's just a sign that the medicine was very potent. And knowing a kind of system we live in, people take advantage of this. And you never know who buys it. Could be your sister, could be your brother, could be anybody. So yes, back to the regulatory authority. For me, yes, regulatory authorities will be there every day, but the onus will lie on us, the public and journalists, to rake out some of these things and put out there against the constraints that regulatory officers have. Poor number of people, poor salaries across the African continent. Regulators cry every day. Forget not that the thing is out there on the market for me and you. I am, like I said, a strong believer of traditional medicine, and many other friends of mine are. If we don't take that important step to talk about this and to push the frontiers of making this known and getting our people educated about it, at the end of the day, if anybody should be dying, I tell you, it's not going to be the regulators, it's going to be me and you.
Exactly. All right. Now, in your documentary, the Abdullah brothers you talked about were eventually arrested by the authorities. But we also know that it is not just the Abdullah brothers or the COA FS that are involved in this. There are so many others who have different claims. What is the authorities doing to ensure that they minimize or arrest or ensure they stamp out all of these quacks that are posing threats to the public?
First of all, I must emphatically state here that our regulator was already working independently on this particular subject. Again, the regulator had on their own issued an earlier statement on COA FX, saying that in fact, their product was infested with E. coli, which are remnants of feces, intestinal matter, and all that. So on that, it's very difficult to blame the regulator. But generally, regulators across the African continent have this pushing of this sit down and not approach things in a very strong way. They will give all sorts of reasons. But I think that we have to keep on pushing. And I think that, like I have said already, it's not going to just be, we can't just fold our arms and look at the regulator. We have to keep them on their toes every single time. We have to prove to them that indeed, as citizens, we deserve to be given the best.
All right. Well, I really agree with you. As citizens, everyone deserves the best. Thank you so much, Anas, for what you do and what you're doing in Ghana and even across the African continent and the world when it comes to investigative journalism. Let's head into the papers. Daily Times is where we start from. SPW recruitment modalities. Keyamo National Assembly members in shouting match. That's what you see on the front page of the Daily Times. From there, let's go to the News Direct, that says federal government moves to recover 5-year stamp duty backlog as FIRS generates 66 billion naira in 5 months and targets 1 trillion naira annually. That's News Direct. Blueprint newspaper is next, and it says uproar in National Assembly over 52 billion naira, 774,000 jobs. Keyamo blows hot, resists project takeover by the lawmakers, and says they can't direct executive, insist only Buhari can stop implementation. From there, let's go to the national economy now. Suspension of new tariff. Expect no improvement in power supply, discos tell Nigerians. Okay, really heartbreaking, I must say. From there, let's go to the Leadership newspaper and says the Labour discos on warpath over electricity tariff hike. Will mobilize to resist increment. The NLC is saying this and says discos must refund bailouts. PMB, National Assembly agree on delay of takeoff date. Daily Times is the last, Daily Trust, sorry, is the last one we're having right now. And he's still talking about electricity tariffs. Lawan Gbajabiamila meets Buhari, make case for subsidy. Discos say federal government must pay differential. And government spends 1.8 trillion naira on intervention in 6 years. That's what that's what you see on the Daily Times. All right. So as the world struggles to find a vaccine for the novel coronavirus, so many people have come forward with claims of having a cure for the virus. And an underworld of quack doctors and con men have been exploiting the COVID-19 pandemic and making money selling fake coronavirus cures. Investigative reporter Anas went undercover in Ghana, exposing a COVID-19 scam said to be worth thousands of dollars. He joins me now via Skype from Ghana, Accra in Ghana. Anas, it's good to have you join me this morning. Your documentary, Corona Quacks, has gone viral so far with a lot of big. In fact, as at this morning, some people were requesting to see the documentary. Now, talk to us basically, after this came out, what has been the reaction of Ghanaians from what you observe when it comes to their knowledge and their response to or attitude towards some of these drugs?
Well, it's been mixed feeling. Generally, it's had very good reviews. If you go to the BBC Africa website, you realize that we've crossed 500,000 and it's going close to 1 million views. And I believe that by close of day, it's going to go higher. People are shocked. People are surprised because they just can't fathom when the lockdown was on, how people got the opportunity to still think through, to be able to take advantage of poor people and to milk money out of them. So it's been mixed feeling, mixed reaction. But then it all goes back to this sense of human beings are human beings. Yes, the problem is here. You can't do anything about the pandemic. The best you can do is to ensure that you are in a position to guard yourself against fake medicines.
All right, Anas, what do you think makes the people so vulnerable or gullible sometimes? Would it be seen as fear or ignorance or sometimes even curiosity? What have you observed?
I think this are special times. Since I was born, never seen a situation where we have a pandemic just springs a surprise on us and I'm told not to get out of my house. I'm told to make sure that I wash my hands uncountable. All this put together created some level of fear. And especially when these quack people were selling their medication as preventive medicine. So people think that to do away with washing hands, mask, and all that, and the fear, if I can get some medicine that can do the magic in 10 minutes or in 30 minutes, then that saves me all the hassle. So it's a mixture of feelings, but people die every single day. So People are talking about ventilators. Hospitals are crying. Presidents are giving national addresses. So if the poor man sitting in the village is told something, and especially the person reads it on a newspaper or radio, they tend to put their belief in that, against the backdrop that we have a largely uneducated populace.
All right. Now, in your documentary, you interfaced with the FDA in Ghana, that's the Food and Drug Authority, and you spoke to the head of the FDA. Did you find out whether the FDA and such, food administration agencies or standards organizations generally have the capacity to, to try to mitigate or prevent the spread of fake drugs and fake foods and all of that that pose a threat to the public?
My study across the African continent on regulatory authorities such as the FDA, NAFDAC, and other places shows that when you take the population size and the number of workers that they have, it's virtually impossible for them to be able to cover everything. Also, when you look at their salaries and conditions, which is a problem generally in Africa or any third world country, they even don't have that capacity to be able to reach out anywhere. So it's let's help ourselves. Let's hope they help us situation. It's not something that one is proud of on the African continent. Look, over 100,000 people die out of fake medicines across the world and 30,000 in Africa. It tells you that, indeed, a lot more people are dying out of quackery, and people are actually, our regulatory organizations are sleeping on their job.
All right. Now, okay. And as when it comes to investigative journalism that you have been doing with a lot of passion, on the African continent, if we make comparison, we've not seen much of investigative journalism busting lies and busting deceit from people, of investigative journalism busting lies and busting deceit from people. We have just a very few of you doing this to the level to which you are doing it. What do you think is responsible for not having so many people, when actually that is one of the ways to bust lies and hold government accountable, and even any authority for that matter?
Well, investigative journalism is not a tea party. It is a very difficult and dangerous enterprise, as well as an expensive enterprise. But that is what holds government accountable across the continent. You'll recall that last 2 years, a colleague of mine, Ahmed Swali, was shot dead twice in his heart and one in his neck. Shot dead, broad daylight. And I would recall lots of African journalists who have died on the job. This alone creates that fear, apart from the poverty that many media organizations face, because organizations are not able to sponsor proper journalism. So this put together creates a very difficult atmosphere. But I must doff my hat for some African journalists. There are a few investigative journalists in Nigeria. We have very strong people. You know of a lot of your newspapers, Premium Times, Daily Trust, and many other organizations are doing great work in journalism. In South Africa, there are many other colleagues of ours who are pushing the frontiers in Zimbabwe, in Cote d'Ivoire, in Burkina Faso. So we are pushing. It's not going to be difficult. Don't also forget that we push against the politicians who don't want to be exposed. We push against businessmen who do drugs. We push against all the hard people in society. Now, when you push these bad guys, they push back. So it's not going to be an easy ride. We can only encourage people who can invest in journalism, media organizations, to stay firm with their journalists in times of crisis. Apart from that, we can only pray and hope for the best.
All right. Now, Anas, we're rounding off gradually, but let me ask you this. In all of this that you're involved in, busting all of those things, do you fear for your life sometimes?
Last 3 years, we were we did a judicial scandal which involved over 34 judges and over 100 court officials caught in bribery. We've done the football story, as you remember, in Nigeria, where we took top FIFA executives.
Yeah.
We took football referees out of office, football managers across the continent. Huge investigation. So it is not something that we would say it's going to be easy. The difficulties will still be there. We will aim at still pushing the frontiers and hope that as we push these frontiers, we'll have society stand by us. You see, the biggest support we have is civil society. They've always been there for us, and that has encouraged us to push on. I will urge my colleagues on the continent that sometimes this job can be that lonely, but hey, they should keep their eyes on the road, because posterity will never forgive us if we give up.
Okay. Now, what really gives you that drive on daily basis? What gives you that? What gives you your strongest passion as you venture into investigation like this?
When I get into any story, I ask myself, how does that story benefit my grandmother in the village? How does it benefit my sister? How does it benefit the African continent? If you look at the story we did in Malawi, Africa Eye, which was Malawi's human habits. It's about human beings who were being virtually killed for ritual purposes. You ask yourself, how do you feel to have your colleague human being killed? You know, so we are driven by society. We believe that whatever we do must impact on civil society. So the single motivating factor that urges me on is society, is what we see every single day. I would remind you that this film is translated into 30 languages, and go onto the Africa Eye page on the BBC. There are many more great stories that you can see, and we are doing much more. And we will encourage all my colleagues, Nigeria, elsewhere, to bring in ideas to the Africa Eye team at the BBC, and we'll all see how we can put our heads together. Shine light on this issue to make society better.
Thank you very much, Anas, for talking to us on TVC Breakfast. Really appreciate you, and we commend you for what you do for Africa generally. Thank you.